Hello everyone, I am Dr. David Pascal and welcome to my Facebook Live, Dr. Pascal's CRPS Solutions page. And today we are going to talk about the biggest danger for every CRPS patient. And that biggest danger for every CRPS patient is waiting too long to get effective care. And this happens two ways. One is it can take a very long time to actually get a diagnosis of CRPS, and I'll dive into that in a moment. And then the second thing is once you have that diagnosis, getting the correct effective care that can actually help move a person into remission. These are two things that are difficult for the patient. You guys don't have the experience of a trained clinician. It's your first time getting injured this severe, and the biggest shock that happens is, someone sprains their ankle, typical beginning cause of CRPS. They have a bad sprain, they go to the ER, they x-ray it, they go, okay, you didn't break any bone, you didn't tear the ligament, but you've got a bad sprain, so let's put you in a boot. They put you in a boot, you go home, and the pain doesn't subside. It gets worse and worse until the person can't take it anymore. They go back to the hospital. They say, oh, maybe the boot's too tight. They loosen it. They do maybe a couple more tests. It's all swollen up. Pain's horrible. And they say, well, it'll go away in a couple days. And for almost everybody on the planet, it does go away in a few days, or at least that horrible pain, it subsides. But for a very rare, small number of people, for specific reasons that we've talked about in other lives, the pain doesn't go away, and it just gets worse and worse. So now the patient, or if it's a minor, the parents of the patient take their kid, and now you go back to the doctor and you're trying to figure out what the problem is and why the pain isn't going away. All the while that it takes to be diagnosed, a couple things are going on. There's more damage going on into the local area of wherever that original injury is and to the nervous system. And there's an emotional toll. There's an emotional toll to the patient being in pain like that, to the caregiver, to see their child in that type of pain, to the extended family members that are aware of what's going on. So there is a big emotional toll that rolls over into a physical issue. And there's a financial toll. These doctor visits aren't free unless you have amazing health insurance. And so right from the very beginning, that clock is ticking where there's more and more damage going on, and the financial resources, no matter where they're starting, they are getting smaller. The sooner that you can get to a doctor that has experience of getting people that have CRPS into remission, the faster your recovery is, the greater your chances of even getting into remission. When I look back over all the years that I've been seeing patients with CRPS, what we found is they really fall into two distinct categories. One group of people that we see come to us fairly early on. Maybe they got really lucky and were diagnosed right away, and they came to us within a month of their diagnosis. Maybe they're a local patient, and when they got hurt, they were fortunate enough to live nearby, so I was the first person after the ER that they saw. Or through a friend or some of our media presence, they found us within the first, let's say, 6 months or even year of their original onset of CRPS. And those people, we have so far had 100% put those patients into remission, every single one of them. The second group are people that for various reasons, took a very long time to be diagnosed, right? They go to one doctor, they go to their ER first, and they still have a problem. They go to their GP, GP can't figure it out. So then they send them to maybe an orthopedist recommends PT, they go to the PT doesn't handle it, they go back to the GP, then from the GP, they maybe to a pain center does their stuff, they're still not getting better, so then they might recommend some other clinic, like Mayo or John Hopkins or Children's Hospital of Philadelphia, and then, or Duke, wherever you are in the country, UCLA, and they'll travel there and be seen, and usually, they're of little help because in Western medicine, they're really the only tools that they have for a patient in pain is give them an anti-inflammatory, hope the swelling will go down, and that will get rid of their pain. Give them some type of painkiller, anything from something very mild to something very, very strong. If that doesn't work, try to mobilize it to do some type of classic physical therapy, chiropractic acupuncture. That usually is very ineffective. Then something more invasive like a nerve block or a spinal cord stimulator. Now they're being very invasive into the body, or even nerve ablation where they're trying to cut the pain nerve. Most of the people, about 20% of people with CRPS respond to that type of care, either classic Western medical care or PT, chiro, acupuncture. The other 80%, they're the ones that are in big trouble, and they're searching, going to all these different things, and the danger there is, again, twofold. Each procedure can cause nerve damage. That nerve damage could be irreversible, right? Just from the procedure alone. I haven't had a patient that came to me that had a spinal cord stimulator where the spinal cord stimulator didn't create more problems than it was trying to fix. Again, the longer you're in pain, the more mental impact that's going to have on you, because being in pain is a horrible thing. There's tissue changes, and then again the ever-present financial drain. Even if you have insurance and you're just making co-pays, you still have travel expenses and your co-pays and your maximum medical benefits, all for care that isn't being effective. And that is the danger, because by the time these people make it to me in the second group, it might be 4 years, 6 years, 10 years down the line, and there are very significant physiologic changes. There are neurologic changes. There are emotional changes. Sometimes there's huge emotional trauma just from the care. For example, one type of care, is to to desensitize the person, like at CHOPS Hospital in Philadelphia. They'll take children in high pain and tell them to just, the pain's all in their head, to just walk through the pain, move through the pain, and if they did that, then they'll be fine. And when I see these kids, they're shell-shocked. They have PTSD. It's been a horrible experience to be invalidated for your pain and then be told to ignore it and overcome it, as a 6-year-old or 8-year-old or 14-year-old. It's just terrible. So these are really the biggest dangers. And so how can you avoid that? As a patient, you need to try to take control of your own care. When a doctor says, I think you have this, you should say, well, doc, why? Why do you think that? And a response of like, well, because I say so is not acceptable, right? They should be able to explain their diagnosis. If they propose a treatment plan, then it's your job as the patient or the parent of the patient to ask, okay, doc, why do you think that is the way to go? And they should be able to articulate that in a very straightforward, understandable way. And then the next question is, okay, if we do this treatment plan and it doesn't help, what's your next step? They should have a clear answer for that too. So those are really the biggest dangers for every CRPS patient is waiting too long because there's more damage physically and emotionally. Doctor hopping, going to doctor. Again, you have those first two things and the financial drain. So I hope that that helps. I think we have a question or two that I'll be glad to answer.
Can you explain what is happening in the body when a flare occurs and what we can do to calm a flare?
So when a flare-up is occurring, of course, it doesn't really matter where that is, whether the symptoms are full body or just in one area. What has happened is those sensory nerves, primarily the pain nerves, are overfiring again and telling the brain, hey, we have this awful pain. And there are many different causes for that can cause a trigger. It can be other parts of the sensory nervous system that get irritated and overflow onto the pain nerve. You can eat something that's inflammatory. A lot of CRPS patients have a lot of sensitivities and allergies, and these can lead to a flare-up. You can have emotional upset that leads to flare-up. But the bottom line with a flare-up is that the pain fibers are firing again. So if you don't know exactly what caused it, like if you know you had a big fight with someone or some emotional stress or something, and then that was your trigger, then the best handling is some type of mental emotional technique to lower your physical stress, right? Getting outside, listening to music, doing mindful activity. If you notice that when you go eat fast food or a bunch of processed food, that 2 to 3 days later you have a flare-up, there's a great indicator that your cause of that flare is eating things that your body is sensitive to or allergic to. Another common cause of a flare, people start to feel better, and then as they feel better, they increase their physical activity. And then they flare up. So, they decide, well, if I haven't been to the mall in 3 years, I'm going to go there. And instead of just going to the mall for an hour and coming home, they decide to spend 4 hours walking around. Most physical things are because of overdoing. So those are the most common causes. If you can find the cause, then whatever caused it, don't do that. Do the opposite of that. And that will get you out of that flare quicker. Okay, so if you have another question, please post it. One more question that you can ask the doctor after you've said why is that your opinion and what should you do about, what are you going to do next if that first treatment doesn't work, is to ask the doc, well, what do they expect? Hey, you said I should go do XYZ, or we're going to take this drug, or we're going to do this procedure. Then ask, so what do you think that is going to do for me? Is it going to increase my strength that I've lost, or handle my inability to eat food without a flare-up, or tolerate light touch, or in my foot, whatever your symptom is? Asking specifically what the doctor expects the outcome to be, and also what the time frame is. Now, these last two questions are very tough questions for a doc. I get those questions asked all the time, and they're fair and important questions for the patient to ask, but being fair and important doesn't necessarily mean that there's a ready answer. I don't know how long it takes a person to heal. Some people are very fast healers. Some people are very slow healers. Some people are doing things consciously or unconsciously that are setting them back. And these are factors that I don't know about and have no control about. But I should be able to tell the patient in general my expectation of outcome, certainly 100% my reason for doing something, and my next step. Do we have a question? All right. Well, I appreciate you all being here. I think that this is the type of thing, what those biggest dangers that every CRPS patient should be aware of, that when you think about that on your own, that you will come up with more questions. And that's why we're going to keep this video posted on our website or on our Facebook page, and you'll be able to ask further questions. We try to monitor the board fairly closely and get an answer to you when you do post. In the meantime, I wish you all healing. I implore you, if you are still going through a decision-making process, to call my office, get on a Zoom call with me, and let's see if I can help you or get you to someone that can, because time really is of the essence. It really plays a major factor, the number one factor in your outcome as a CRPS patient. And remember that this Facebook page is free to join. Please tell your support group, tell other people in other groups that you know that have CRPS to come in and join. We want to build this community so that we can support and help more people. All right, I wish you all the best. Take care.